A review has found there was an atmosphere of crisis leading up to the closure of what was Queensland's only long-term mental health facility for adolescents. 3 former patients have died since the Barrett Centre closed earlier this year. But a Queensland Health Commission report says transition plans were appropriate and comprehensive.
Until January, the Barrett Centre at Wacol in Brisbane's west provided inpatient care for children and teenagers with complex mental illnesses. The Health Minister announced the closure in August last year, giving staff 5 months to develop transition care plans for all patients. The ABC has obtained a copy of a review of that process conducted by 2 interstate experts. It says transition planning occurred in an atmosphere of crisis, with a contagion effect of distress and anxiety amongst the adolescents and an increase in incidents on the units.
I think it's very difficult to say that it was ideal, because certainly the ideal is that you take it at the young person's pace. So I think that there was a sense of rush.
It describes the task of finding alternative treatment as enormous given the complexity of patient needs, but says individual plans were appropriate and took into consideration patient care, patient support, patient safety and service quality. But the report authors didn't interview patients or parents or look at the care provided once the centre closed.
The parameters are so narrow that it hasn't looked at any of the really key aspects of a transition that's as serious as that.
The coroner is investigating the deaths of 3 former patients, including Townsville teenager Caitlin Wilkinson Whittaker, who took her own life in August. Melinda Howells, ABC News.